So today we'll be learning about spleen in this video. So let's get started. So spleen is a lymphatic organ. It is connected to the blood vascular system. So let's get to know about location, dimension, position, external features and relations, blood supply, nerve supply, lymphatics and clinical anatomy of the spleen. So first we'll deal with the location. So where is our spleen located? Spleen is basically present in the left hypochondrium and partly in the epigastrium region. So it's wedge-shaped organ. It is also tetrahedral in shape, right? So this is the location. You can also say that it is present between the left dome of the diaphragm and also the fundus part of the stomach. So going on with the dimension, let's get to know the dimension of spleen in an easy way. So first, remember all these odd numbers like 1 to 11. So what these odd numbers mean is that spleen is 1 inch thick, 3 inches broad, 5 inches long, 7 ounces of weight it has, and it is present between 9 to 11th ribs. So that was the dimension of spleen. So coming to its position along the long axis of the 10th rib. So let's say this is the 10th rib and spleen is present along its long axis. So that is what the statement means, and it is also directed downwards, forwards and laterally, and it gives an angle of 45 degrees in the horizontal plane. So next, moving on with the external features, we have 2 ends, 3 borders, 2 surfaces, 2 angles and 1 hilum. So what are the 2 ends? That's the anterior end and the posterior end. You can see in this diagram the anterior end is wide enough and it's directed downwards, forwards, and it reaches the mid-axillary line. You can see this is the mid-axillary line. So posterior end is not wide enough, but we can say it's rounded and it is directed upwards, backwards and medially, and it rests on the upper pole of the left kidney. So they are the 2 ends. So what are the borders? The superior border, intermediate border and the inferior border. Superior border, it is notched near the anterior end, and the intermediate or the inferior border is round enough. It is near the posterior end, and intermediate border is rounded and it's directed towards right. Let's say he's a man and he has got a spleen over here and the intermediate border is towards its right. That is what the statement means, right? So next, the borders, we have superior border, intermediate border and the inferior border. So superior border, it's basically, you can see over here. So superior border is notched near the anterior end and the inferior border is round enough. What about the intermediate border? It is also round, but it is directed towards the right. Spleen is present on the left side, where intermediate border of the spleen is directed towards your right side. That is what it means. So coming to the surfaces, we have diaphragmatic and visceral surface. You can see in the diagram over here. This is diaphragmatic surface and all these are visceral surfaces. So diaphragmatic surface is convex. So it's convex and it's also smooth. Whereas the visceral surface is concave and it is irregular. It consists of various impressions like gastric impression, renal impression. We will learn about all that in the next slides. So next we have the angles, anterobasal and the posterobasal angle. What is this anterobasal angle? It is near the junction of superior border with anterior end. It is also known as clinical angle of spleen. Why is it called so? Because in case of splenomegaly, or you know what is splenomegaly, right? The spleen is enlarged in a person. You will be able to palpate it. So where you can palpate it? At this anterobasal angle. So it's first felt at this angle. So hence it is also known as clinical angle of spleen. And the posterior basal angle, it's present near the junction of inferior border and the anterior end of the spleen. So coming to the hilum, it's present between the superior border and the intermediate border. So this is our hilum of spleen. So what are the contents or structures that pierce the hilum? Splenic vessels, right, which will be discussed later. So this was about external features. Moving ahead with the relations, we have two, that is peritoneal and the visceral relations. So first we'll deal with the peritoneal relations of the spleen, that is we have gastrosplenic, linorenal, phrenicocholic ligaments. So gastrosplenic ligament, what is it? Gastrosplenic, from the stomach to the spleen. So it extends from the hilum of the spleen to the greater curvature of the stomach, you can see over here. So this is gastrosplenic ligament. So what are the contents of gastrosplenic ligament? It consists of short gastric vessels, and it's associated with lymphatics, and it also contains sympathetic nerves which are present, and they also supply the spleen. So next, linorenal ligament. It also extends from the hilum of the spleen till the anterior surface of the left kidney. So this linorenal ligament, lino, spleen, renal, kidney. So from spleen to kidney, linorenal ligament. So it is pierced, or it contains tail of pancreas and pancreaticosplenic lymph nodes and sympathetic nerves. So what is the third one? That's the phrenicocholic ligament. This ligament is not attached to the spleen, but it supports its anterior end. So that was peritoneal relations. Coming to the visceral relations, we have fundus of stomach, anterior surface of left kidney, splenic flexure of colon, and tail of pancreas on the visceral part or the visceral surface of the spleen. So you can see in this diagram, we have the anterior surface of kidney, splenic flexure of colon, what else? Tail of pancreas, you can see this. Right. So what are the impressions on the visceral part? We saw a few impressions in this diagram, right? Gastric impression, renal impression. So we'll look at it over here. So gastric impression, it is for the fundus part of the stomach. So it is between the superior border and the intermediate border of the spleen. So it is concave, and it's the largest impression. You can see it occupies a large space on the spleen. So that is gastric impression. So coming to the renal impression, it is for the left kidney over here, this part. So it is for the left kidney, and it lies between the inferior and the intermediate border of the spleen. So the colic impression is for the splenic flexure of the colon. It is triangular in shape. You can see that it resembles a triangle, and it adjoins the anterior end of the spleen. So this is the anterior end of the spleen, and this is the posterior end. So that's what it means. And pancreatic impression, it is from the hilum to the colic impression, or it is between the hilum and the colic impression over here. So this is for the tail of pancreas, right? So this is visceral relations, all about visceral relations. So what do we have next? Blood supply and nerve supply. So blood supply, going on with the arterial supply. Which artery supplies spleen? It's the splenic artery, and it's a branch of celiac trunk, and it is tortuous. Why is it tortuous? Because it is tortuous. Spleen can move, so it allows the movement of spleen, and it gives branches like pancreatic branch, short gastric vessels, left gastroepiploic artery. All this, these two will supply the stomach. Pancreatic branches will obviously supply the pancreas. So which other artery in the body is tortuous? Comment down below if you know it. So splenic vein, venous drainage. We have a splenic vein. So this has a straight course. It is formed at the hilum of the spleen. So this splenic vein, it joins with the superior mesenteric vein, and it together forms the portal vein, right? So let's see the branches of splenic vein. It gives inferior mesenteric branch, pancreatic veins, or the pancreatic tributaries to pancreas, and also left gastroepiploic vein, and short gastric veins, and the splenic vein as such. So the branches are only short gastric, pancreatic, inferior mesenteric, left gastroepiploic vein. So that was the venous drainage. Coming to the nerve supply. So spleen is supplied by sympathetic fibers which are derived from the celiac plexus. These are vasomotor in nature. So lymphatics, it doesn't have any lymphatics. Like the spleen proper has no lymphatics, but a few lymphatics that arise from the connective tissue of capsule, which also include the trabeculae, they drain into the pancreatico-splenic lymph nodes. So they drain into the pancreatico-splenic lymph nodes. So that was about all the supplies of the spleen. So next we have our clinical anatomy, my favorite part. So you can feel or palpate the spleen on the left costal margin. You may ask the patient to turn towards its right side, and spleen can only be palpated when it is enlarged twice its size. So that's also one more thing. So coming to the next one, that is the splenectomy. What do you mean by splenectomy? Surgical removal of spleen is nothing but splenectomy, right? So during this, the surgeons they may cut or damage the tile of pancreas because it is present in the hilum, right? So this has to be carefully avoided. So tile of pancreas, it contains islets of Langerhans. So tail contains islets of Langerhans. What is the function of islets of Langerhans? They basically produce hormones like insulin, somatostatin, glucagon and all that, right? So you know how hazardous it could be if there is no insulin in the body, right? So it has to be avoided, and this has to be done very carefully. So they will ligate everything. Like spleen has two pedicels, gastrosplenic and renorenal. This the contents are separated carefully before ligaments are cut. So that was about splenectomy. Coming to Bunty's disease, it's a chronic congestive enlargement of spleen. It results in premature destruction of red blood cells. Congestive enlargement of spleen. Spleen is not there. Premature destruction of red blood cells takes place. And we have our Bunty's disease over there. So what is it? Chronic congestive enlargement is taking place. It results in premature destruction. Premature destruction of what? Red blood cells. So what happens in that case? Yes. So that is Bunty's disease. So next we have the splenic puncture. So spleen can be punctured through the left 9th or 10th intercostal space in the mid-axillary line using a lumbar puncture needle. I think we know about lumbar puncture. We have studied about it in our neuroanatomy. So it can be punctured through the mid-axillary line to avoid laceration of spleen, and the patient must hold his breath during this procedure. So that was about spleen. So I hope you enjoyed the video, you understood, you were able to relate with what I was telling. I hope you all liked it. Thank you for watching. Like, share and subscribe for more videos.